It's January 4th, 2021. One of the most closely watched experiments in American healthcare was unfortunately coming to an end. It's called Haven Healthcare, the company that was created by Amazon, Berkshire Hathaway, and JP Morgan Chase. They were announcing on that date that Haven Healthcare is shutting down. Think about those three names just for a minute: Amazon, Berkshire Hathaway, JP Morgan Chase. Three enormous companies, three extraordinarily successful business leaders. I mean, think about it: access to technology, to capital, to data, to talent, and more than 1 million employees. And less than 3 years after they started it, it was done. Haven Healthcare was over. Its CEO, Dr. Atul Gawande, had already stepped down from that role. Its COO had left even before him. Haven's remaining employees would be absorbed back into the companies that created it. So what happened? Well, that's the obvious question. A lot of people have actually studied what happened and why did it go wrong, but that's not the question I want to start with, because we already know something about the people making those decisions. And we know this because we know how the story ends. And that gives you incredible hindsight bias. And once you know the ending, it's really easy to look back and really pinprick all of the reasons something was destined to fail. But on viral healthcare, we talked a lot about looking forward. We know that leadership, governance, strategy, competition, execution, they're all problems. But again, that's hindsight. What I'm interested in is a much harder question. If you had been sitting in the room in 2018, knowing only what you knew then, would you have made the same decision? To answer that, we have to go back 3 years. Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. On viral healthcare, we look at the ideas spreading across healthcare and what it takes to implement them wisely and sustainably. So, this is part one of a four-part series where we're going to explore and try to understand Haven Healthcare, how it started, how it evolved, and how and why it became unsuccessful, like so many innovations that we talk about. But I want to break it down and hope you'll join me over the next 4 weeks as we look into this situation as they did, as you might do with trying to apply lessons from Haven Healthcare to the innovations, the ideas that you're implementing in your organization. All right, so go back to the beginning. On January 30th, 2018, they made an announcement. Who's the they? It's Amazon, Berkshire Hathaway, and JP Morgan Chase, and that they were going to form this new company to really, really shake up and disrupt healthcare for their US employees. And the reaction from many was immediate, because these aren't just three healthcare companies trying another type of healthcare initiative. One of them changed the way people buy things. I mean, I don't know about you, but I have an Amazon account and I certainly use it. And one is led by arguably the most famous investor in the world. This guy doesn't make mistakes in his bets on the future. And one of them is the largest financial institutions in the United States. And now they're turning their attention to healthcare. That really is an important pivot in their lives, in their company's activities. So at the time, and it's not that uncommon because we've seen it now and way back when, employers were dealing with rising healthcare costs rising much faster than inflation, taking a bigger chunk of their HR budgets. And employees were struggling how to actually pay those costs because more of them were coming on them. And it was an enormous amount of money. And really, we couldn't really identify the better outcomes that this money was having. So a lot more cost, not much difference in outcome. None of this was a secret. What was different about that announcement in January of 2018 was who decided to do something about it. Warren Buffett described rising healthcare costs as this hungry tapeworm on the American economy, something that was kind of hidden and slowly eating away at the core of the economy. Jeff Bezos acknowledged from the beginning that this wasn't going to be very easy at all. And Jamie Dimon talked about bringing the company's resources to improve outcomes, satisfaction, and cost. I'd like to do that too. And I want to stop here because this really is the first decision point. Forget what happened later. That'll give us hindsight bias. It's January 2018. You're sitting at the table. You're sitting with Amazon, Berkshire Hathaway, and JP Morgan Chase. And you have a population of 1 million employees across these organizations. And you have resources. You have money. You have data. You have purchasing power. You have technology. And you have an industry that almost everyone agrees isn't working, and it could work a lot better. Wouldn't you think that you had a pretty good chance of being successful? I probably would have. So there have been, before this, many attempts to try to improve healthcare. A lot of it came out of government action, the Affordable Care Act, or what people call Obamacare. That one tried to work on access and coverage. What it worked less on was cost, but it set up for experiments for cost. So out of that came new payment models, new technologies, new benefits designs, new delivery systems, bigger delivery systems, integrated delivery system, new companies promising to make healthcare simpler, cheaper, faster, and wow, wouldn't this be great? Even more consumer friendly. But this one felt different. Part of it was simply how big they were, the scale at which they were talking about. These companies weren't coming into experiment, wondering where they'd get the resources would come from. They had them already. They weren't trying to create demand from scratch. They had an enormous population of people that they were already buying healthcare for. And they brought very different capabilities to the table. So think about it for a second. Amazon, it's really great at technology, logistics, consumer experience, and doing it at scale internationally, and being able to make that last mile where they actually deliver the product effective. JP Morgan Chase, they understood financial systems, large employers, complex markets. They understand all of the different factors that make healthcare really this nasty, ugly mob of people and organizations. And Berkshire Hathaway brought financial resources, a long-term investment philosophy, and at least a modicum understanding of how insurance works or how it could work even better. On paper, you would have to say, and I remember thinking at the time, that's a remarkable combination. If anybody can do it, it's these three organizations. And it's important to remember that because the easiest mistakes that we can make when we study a failed innovation is to make the original decision look foolish. And this wasn't foolish. I didn't think it was foolish. I thought it was exciting. What were the possibilities? And I'm sure a lot of people in the group that made those decisions felt the same way. It was reasonable to assume, and I certainly didn't when I was there, that it might work. And so there was also, though, this question hiding underneath all of that excitement. And that's exactly, what are we going to fix? And that's a lot bigger and nastier than just saying you're going to be disruptive. So let's talk about that for a minute. What is the size, magnitude, and reach of the problem? It's not just one problem. And it's something that people have talked about. I read research from back in the 20s and 30s in the United States on how to try to reform and fix the broken healthcare system. It's 1,000 of interconnected problems. You can lower prescription drug costs, and that work has been done on multiple levels in many administrations in the American history. You can redesign employee benefits. There are large purchasing coalitions in many states that have tried doing this. You can improve access to primary care. And a lot of organizations, both in the private and public sector, have done this. You can change how providers are paid. And this experiment has been going on since the 70s and 80s. You can improve navigation. You can reduce unnecessary utilization. You can make prices more transparent. You can build better technologies. You can improve chronic disease management. But you can just see from this list, It's very difficult to tackle all of them simultaneously. And each one of them is an incomplete major initiative on its own. And this is where an ambitious mission became complicated very quickly. Because there's a difference between having a compelling purpose and a very implementable aim. I mean, this is something that happens all the time. This is where people bang their head on the wall and go crazy because they can't fix something. But I don't want to jump ahead. I want to stay in the moment in January of 2018. At this point, the ambition itself is what makes it so compelling. The companies aren't saying, we're going to make one little small adjustment to an employee health plan. We're going to tweak one little price negotiation category and say drugs or provider payments. They're suggesting something much bigger. They want the system itself to work differently, to be disrupted. And then in June of 2018, the venture makes one of its most important decisions. That's about 6 months later. It chose its first leader, and that leader was Dr. Atul Gawande. And if you were designing a healthcare organization meant to rethink and redesign how healthcare works, Dr. Gawande is a really fascinating and interesting choice. Let me go through some of his background. First, he's a surgeon and a practicing surgeon. He's a Harvard professor, highly trained, an educator who's really done a lot of research. He's a public health researcher. He's a best-selling author. And most of his articles have talked about how the system works at the most fundamental levels and how people have successfully broken it to fix it. He spent years thinking and writing about some of the hardest questions in medicine: quality, cost, unnecessary goal, patient goals, systems, checklists, and how you actually get better at practices that you can spread. He also, by the way, built this company called Ariadne Labs, and it was out of the Harvard group that took these really smart people, and he said, let's find ways to fix healthcare problems that we can test systematically, design, test, and then scale across the country. So go back to January and in June of 2018, put yourself back in your moment, in that moment. You're trying to build something that isn't simply another insurance company, not just simply another purchasing coalition. You don't necessarily want a traditional healthcare executive who will reproduce the system. But I bet in the dialogue that they had leading up to that June announcement, they actually thought about, do we want an experienced, a seasoned insider who really understands it? Or do we want an outsider who's described it from outside of the health system? And let's see if we can use that insights to do it. So I think they wanted somebody who understands medicine, who knows the nuances, but wants to question and break how the system is working. So at that point, Dr. Gawande made a lot of sense. And when his appointment was announced, he described the opportunity in really, really, ambitious or bold goals that he wanted to accomplish. Building scalable solutions for better healthcare delivery, reducing suffering. I mean, that's kind of what we wake up in the morning trying to do, and eliminating wasteful spending. And he had something that most CEOs would kill for. He had time. At least theoretically, he had time. Because Jeff Bezos said this organization, this effort is going to be long-term oriented. It's not going to happen overnight. It was supposed to operate independently, and it wasn't supposed to be constrained by the usual pressures that a CEO faces. That's to generate profit right away. So he had time and a long-term horizon on his side. He also had resources, and Dr. Gawande would say publicly, resources weren't going to be the problem. So think about how unusual that combination is if you're a new CEO in a new organization. A huge, huge population of employees to deal with, 3 powerful sponsors, extraordinary resources, and now you have this well-respected, insightful, disruptive leader. No immediate profit requirement, and the permission to think long term. It's just hard to imagine. If I were in that room at that time, I would say, is this going to work? And can we stop the story right here? And I bet many of you would agree with me. It's a go and a go, no go decision. So that's the thinking, I think, at the time. I wasn't there. I don't know for a fact. I haven't interviewed any of these people, but you can kind of imagine that setting what was going through their mind. And then you ask the next question, what do you do? What's your first thing you tackle? And this is where this Haven Healthcare case becomes really interesting to me, because once you have assembled the people, the resources, someone still has to decide what's going to be the first thing we tackle on Monday morning. So where do you begin? Do you start with prescription drugs, with primary care, with employee benefits, data, technology, navigation, high cost patients? Do you start negotiating differently with the health delivery systems? Do you build a new platform? Do you partner with organizations that already exist? Super important questions to think about how to do this. Or do you try to just understand the system first and then decide? So that's really difficult. Any one of those would be appropriate potentially to start with. So then the question gets to happen, like, who's deciding that? Is it Dr. Gawande? Is it people below him? Is it in connection with the three sponsors? I wondered early on if they even did something that we've talked about here on viral healthcare, if they did a pre-mortem where you anticipate failure at some point in the future, probably 2 or 3 years out, and you say, we failed and we failed terribly. What would be the cause to doing that? I would wonder if they did a pre-mortem. And if I were there, if I were an outsider, if I were a journalist or some independent person, that's the question I would have asked him. If you were to imagine failure, what would be the cause of it? And if they didn't actually have an answer to that or hadn't thought about it, it might have been a red flag at the moment that they really hadn't gone through the necessary steps to understand this really, really complex, gnarly problem they were tackling. So remember, Haven wasn't just one company, it had three owners, and they're not all the same. So Amazon, their workforce and business strategy aren't the same as JP Morgan's. And JP Morgan's isn't the same as Berkshire Hathaway's. They have its own leadership, their own employees. The employees have different types of skills. They're national companies, so they have some employees in different states. They have different benefit structures, different priorities, and different existing relationships within healthcare. So what does it mean to have this independent company called Haven Health actually mean when you have these three powerful organizations and owners? At this point in the story, we don't know whether there's going to be something different or whether this is going to cause a problem. It might actually be an advantage because they all back off. Instead of demanding to have it done the way they've always done, they realize that we got to think differently. And so we're going to let the Haven Health folks make these decisions forward. Or they could say, you just don't understand nuances. I mean, what happens in New York City is different than what happens in Washington or Texas or somewhere else. They could also be bringing three sets of priorities, and that was impacting Haven Healthcare. These are the nuances that we don't know at the time that were probably even bigger than a complicated health system. How do we structure our organization? How do we have governance? How do we have decision-making processes that are systematic and effective? All right. So I'm going to stop here with the story, not in 2021, but at the beginning in 2018. Haven hasn't failed. Atul Gawande has not stepped down. There haven't been any leadership departures. The competing initiatives inside the parent companies haven't played themselves out. Nothing of that like that has happened. And all of you know is what's sitting in front of you. Three great, extraordinary, impactful companies, more than 1 million employees, enormous resources, a healthcare system that's definitely and desperately in need of improvement, and a mandate to do something meaningful about it. What do? Do you take advantage of this once-in-a-generation combination of resources and try to rethink healthcare? Or do you narrow the problem, like we've talked about on some of the aspects of viral healthcare? One population, one market, one measurable outcome, proof of concept that you can make a change and then spread. I don't think the answer is as obvious as it looks today. And that's maybe why we should be studying this kind of initiative, because Haven made a choice. It made an active choice about how to break down the problem and try to tackle it. And almost immediately, the rest of the healthcare industry started making choices of its own. All right, so that's our story for part 2. This was part 1. I wanted to go back to the beginning, and not with hindsight bias, but try to imagine ourselves in the room with those people making these decisions. The next time, we're going to talk about who loses if Haven Healthcare wins. So if today's conversation made you think differently about leading change, share it with a colleague who's helping guide innovation. And if you want to share this with people and share ideas, I'd be happy to take all the questions and all the ideas you have anytime you like. Thank you for listening to Viral Healthcare. I'm Bruce Spurlock, and I'll see you next time.